welcome to another episode on the Gymboss Rebirth podcast. We're here with the lovely, fantastic looking Dr. Monique Brown. She's looking really nice, guys. All right, so I've been getting a lot of questions asking me to ask the doctor about hygienic care, why our platform is focused on hygienic care. So I'd ask you that. Or you create a platform about that.
Okay, first and foremost, I just want to say thank you so much for having me on your platform. Spreading awareness is a big thing for me. And some of you might know me as Dr. Nique on TikTok and Instagram. So the platform is dedicated to women's health and feminine hygiene because there are so many misconceptions that we have in Jamaica and the Caribbean about how we take care of this vital organ, the vagina. Now, the truth is, a lot of what has been said, from friends, family members, or just what you Google, has a lot of myths and, from the concept of tasting like pineapples to smelling like roses and rainbows. So it was something that I felt I was called to do because there were so many persons on a daily basis asking me or facing these different types of vaginal infections or just confused about how to take care of themselves. And I felt like the platform was best suited to deliver that message.
All right, so you mentioned taste and smell. Were they concerned that their partner were saying that it has a particular taste or smell? What was it concern or a personal concern?
Well, let's talk about the scent first. One of the biggest problem is odor, where women believe that the vagina is supposed to be odorless. So they have been doing so much different types of hacks, tricks, and whatever concoctions they would have made.
So it should be odorless or should not?
No, it can't be odorless. It's just going to have a different scent for everyone else, Like I'm going to have a different scent versus someone else that has a high protein diet. If somebody has more garlic, they might have, that scent.
And what the scent should be like?
As I said, it's going to be characteristics of each person, their individual hygiene. But for the most part, it's going to have a similar scent to what maybe a groin or a pubic or maybe just the skin should have, right?
So is it fair to say that it's mostly based on what you eat or type of food you eat?
The types of food I eat have a very big role to play in it, I would say. But I think hygiene is one of the main things. So the types of soaps, the practices, these type of stuff, those things have a big contributing factor to what your overall order is.
So you don't think most women would know what to do, growing up within the home, their mother would tell them what to do, how to take care of themselves and all of that. You find out that most, even adults, women don't know how to properly care for themselves.
Let's say the first video I had that went viral to the point I was confused was when I told them to stop washing the vagina. No, that video, and let me explain.
The producer in the studio like, all right, well,
Yeah, and let me explain why. First and foremost, most persons did not know where the vagina was located. They have the misconception that the vagina is everything that you see, the outside where you have the lips, the folds, which is the labia. No, that's called the vulva, right? The vagina is inside, so washing the vagina is actually when you try to douche, try to flick water, soap, water, spray anything into the vagina to wash it out. And that is something that is actually practiced, where a lot of women try to douche after having sex to prevent pregnancy, which doesn't work. They tried. No, it doesn't. No, man. Listen, semen, the sperms, they swim fast, all right?
Yeah, man,
you can't
fast.
catch them.
Better than Usain Bolt.
Yeah, bullets, right? So you can't catch them. So you trying to rinse it out makes no sense. And then there's some that I have seen the comments saying they don't want their partner's semen in them.
Oh, after sex?
Yeah, after unprotected sex. So that's also another factor. But, from that video, I realized that there were so many misconceptions, so many things that we were doing. There were so many harmful practices that people normalized. You know, putting garlic in their vagina. You know,
I mean, to even have garlic, because I ate garlic, like, it's a garlic kills certain type of bacteria and stuff like that.
I agree. Garlic
And
has
it's very
antimicrobial properties.
yeah, it's very acidic, right?
Yeah, it's harsh.
It's harsh. So I can't imagine the concept of a female putting that.
Must burn.
It must burn.
Must burn like.
So what they try to achieve when they do that, though?
Right. So, you know, I've seen trends where they're telling women to use a peg of garlic or a piece of garlic and insert it into the vagina, leave it for 24 to 48 hours to get rid of discharges, odors. And, you know, the risks with that burns can throw off your vaginal pH, can make you have a worse infection. And not to mention, like, if you leave something in your vagina for so long, the risk factor of like a something that we call something like sepsis, so like just a very bad infection overall, where it can even spread up to the tubes.
That can occur.
Yeah, that can occur. So like when they do these type of stuff, they're running
Serious risk to their body.
yeah.
So who is telling them about these problems? Is it their spouse or how they check to know if they have this issue? Behind the scene, you were telling me that you can actually check. The women should check themselves by actually, you know, use them finger, smell, and all of that. Taste also.
Right.
You recommend that?
Right. So I personally recommend that you know, every person with a vagina should do a self-inspection at least once per week. You get somewhere comfortable, whether it's on your bed, on the floor, or you, I want to say the bathroom, somewhere where you can lie down and be comfortable. You get a glass or a mirror and you put it down there. You can use a flashlight to shine, or your phone light works. You shine and you can look at the area, look to see if there's any swelling, any bumps, lumps, warts, anything
So they
of that
should do
sort.
self-examination.
Self-examination, yeah, they should. And they should also, you know, check what the discharge looks like. So you can tell when your discharge changes, when you're ovulating, if you have that thin, sticky type discharge. These are all things that should be taught to women, you know, so they're more observant of their body.
So the thing between how a woman, if they have an actual STI than a yeast infection, what's the symptom, what's the look, what's, you know, what should they look out for? And for men, because most men, they don't know as well.
Right, so that's the thing when it comes to, especially a STI. A yeast infection, pretty straightforward. You have a thick, curdle, clumpy type discharge, and it's very common. It's not that, you know, you're nasty or you're dirty because you have a yeast infection. Yeast infections are quite common.
How comes it's common though?
Yeah, well, you know, it's a stats that have shown that, you know, like 3 out of 4 women would have had a yeast infection at some point in their life. That they have actually gone as far as to do research on this. And there are a variety of things that can cause you to have a yeast infection. You know, antibiotic use, you know, the soaps, the types of inserts, even the tampons, the pads, not wearing cotton underwear, being in very tight, wet clothing. All of these things really do
Contribute
affect.
to it.
Yeah, it does. And these are things that we should be more mindful of. And then when it comes to a sexually transmitted infection now, it's a gray area. So I'm always going to opt for you to speak to your doctor because it needs to be treated with prescription medication. And in Jamaica, there are no over-the-counter medications for yeast, so your doctor should really treat you also. So the sexually transmitted infection, the discharge can be anywhere from white to yellow, green, brown, could be blood tinged. And this is from our vast experience of seeing varying types of mixed sexually transmitted infections. Tend to have some type of pain, vaginal discomfort. They'll have some type of belly pain. They might even have a fever. So it's not that you need to have all of the above.
Okay.
right?
There are different signs and different
Different
things.
signs, and that's why it's best that you speak to your doctor. Go get a pelvic exam done. The doctor will look in the vagina, look at the cervix to see if there's any discharge coming from there, treat you quickly, because one of the big problems with sexually transmitted infections with women and even men is that it can affect your fertility by you having something called pelvic inflammatory disease. So, when you go and you try to do a steam or a yoni, whatever, and try to insert, you're just putting yourself at risk because maybe the discharge disappear, but the germ
It's still there.
is still there,
Okay.
right? And that's a problem. That germ being there just, just have like
So
a
with all of this
playtime.
having happening inside of a woman part, it's a very sensitive issue. It does happen. It's a natural process. Would you recommend abstaining from oral sex, basically? Because all of that is happening, and with bacteria and bodily fluid and all of that. Then it is wise to recommend not to participate in those type of activity. So the fact that women is saying that they need that for pleasure and to stimulate the relationship and all of that, you're really putting yourself at risk as
So,
far as you're telling me.
so I think this is one of the
Be
cues
serious.
where I drink water.
Go ahead.
But, all right, on a serious note, right? Drink some water first.
All right, you should go have to drink. That's serious. You're putting yourself at risk.
Really, I just want to drink water right now. I mind my business, but let me answer the question. When it comes to different sexual pleasures and experiences, it's always you and your partner needs to have that discussion, right? I can only advise on how we can be as safe as possible. Now, you and your partner, you're in a committed relationship, you do regular screening for STIs, you use a condom. These are very important factors to look into. If you're going to indulge in oral sex, use a dental dam to protect the area, protect the mouth, and yes, at that point in time, with all the other safe sex practices and your partner's consent, then it is completely up to you, right? I don't get into
People relationship business.
no, I don't get into relationship business.
All right.
So I
sounds
can't.
dangerous to me.
So it sounds dangerous, but I feel as if we are grown, you're in a relationship, doing big people things, and you're supposed to can talk about it, and having that discussion should kind of guide you whether or not having oral sex is something that you and your partner should be indulging.
It should be a discussion
or
between it.
it should be a discussion, and just overall having sexual intercourse, right? So if you're having sex with somebody, you should be able to talk to them about it. You should be able to say, when was the last time you got tested? You should be able to say, I don't like this, I prefer that, because it should be a discussion between
Right.
both.
I'm going to throw something out there. You think that people is having too much, wait, I say basically, the sex that people is having nowadays, it's pointless. Like it's not for most people use sex as to bond with your partner, to connect, for reproduction, and for you're sharing sexual energy between your partner. But do you think the world that we live in now, we're having a lot of pointless sex? I mean, even women at the university level rocking up body counts and to say that they are young, they want to experience life and all of that.
So, I don't believe in the body count thing, right?
don't?
No, and not no, to say that from a medical standpoint, let me just clear that up. From a medical standpoint, yes, it is important to note for men and women how many partners you've had for your risk of sexual STIs and stuff like that. Of course, we do know that what is most important is your practices, how safe you are. Now,
How
for
safe can it be if you have a high body count of over
but who determines what's a high body count? What's a high body count for a man?
for a man?
Yeah.
I mean,
There's no such thing. That's what you gotta say to me.
it's different.
So
It's different.
no, so we're not. It's your platform, so I'm not going to chastise it. No, you have your concept of it, and I get that.
You don't agree?
No, I don't agree.
All right.
I don't agree,
So in
and
the
I
future
can't
you
agree.
have a son and a daughter. Which news would be more shocking to you? Dr. Monique, your son has been engaging with certain type of activity. He has over 20 odd female partners, or your daughter, she has over 20 odd male partners. Which one will?
Both would be shocking to me because I would be concerned about their practices. And just to put this out there, if I have, no, seriously, if I have a son or a daughter or both,
You do the his and the daughter.
no, son or daughter or both. And then I do the his, meaning twins. Not manifesting it right now, but hear me out. I want to be the type of parent that will be able to have the conversation with my children that if they go out, I know that they're being safe every single time. Because one of the things is why my platform is so important, no one talks about it. I can honestly say I've never had a sex talk before from a parent. And if you are listening to this right now, you should nod your head because it's very unlikely that your Jamaican parent spoke to you about sex. And that is why when you say the boy or girl having 20 plus partners is unsafe, I say both, because both men and women are still not sure what is deemed safe for them to have during their sexual relations. So I get what you're saying. You're more concerned because you feel as if, the female is going to be at a disadvantage and all that. I get what you're saying, and I personally don't believe that. But I can honestly say for my daughter or son, if both of them are out there having 20 plus partners, my main concern is first, are you safe? And I would need to know that first before I pass any judgment. Furthermore, I won't judge them. Who am I to judge?
All right. So let's clarify. For a male having more than one sexual partner, women like an experienced male when they're coming into a relationship. A female that has more than one sexual partner or multiple sexual partner, basically that's a lot of trauma coming into a new relationship. Women do not anger trauma. They are not built to anger trauma like our man is built to anger struggle, trauma, and all of that.
All right, so
And
come on.
How
many men go into relationships unhealed? How many men take the time? It's funny because I've actually been seeing quite a lot of data coming forward where persons have been talking about how men have been handling their mental health, how they've been treating their mommy or daddy issues. And I'm not being rude. I'm saying, how many of them have the time to sit down and actually talk to someone? If you look at one of your brethren and say, boy, brother, that girl that mash up my meds and I want to go to a therapist. What am I going to say, brother? You're soft.
Yeah, because the thing,
So how many men do you think actually have had that thought and have been fearful and just went into another relationship unhealed? I'm pretty sure it's a lot of them.
Yeah, there's a lot of men that goes into a new relationship unhealed, but the thing is that men are more, a capable man or a competent man is more able to not bring that toxicity into that new relationship. I think a capable man more than likely use that bad experience from that relationship and try to be better. But a woman,
I would love to believe that.
No, I'm telling you, a woman cannot handle stress and trauma, and having more than one relationship builds up that trauma. You understand?
No, I'd love to see the studies
Why
for that first.
you think
I'd love to see
why you think it
Gymboss.
was
No,
why you think it was traditional for a man to basically want to marry a virgin on the wedding day? Because he is sure that having that partner, having that wife, he'll be able to create new experiences through that partner. you'll be able to take care of her, provide for her. You don't have her saying like, "Oh, I went to Devanos already," and he's like, "When have we been to Devanos?" You understand? When have
Gymboss,
we been
all
to?
right.
No, I'm the.
You're
Well,
fishing, you're fishing for it, and I get what you're saying. I hear what you're saying, and that is your point of view, right? And I'm okay with that. We are entitled to disagree, and that is fine. Yeah. That is what you believe, and I'm so sorry. I think we'll have to have multiple conversations afterwards to dispel those myths. One of the problems with yeah man, it's a misconception. Yeah. So one of the problems that we have with relationships, you have unhealed persons jumping into relationships with people.
I agree with
right?
you.
Men and women. If you can't identify the trauma or whatever problems it was from the first relationship, because, when the relationship doesn't work, it's not really just one person, Something happens, it's both of us, right? So if we are both here and something is not working, and instead of trying to address it, we just jump to the next person. The baggage from that relationship goes with that person. And man or woman, male or female, is the same thing. Now, saying that a woman isn't built to handle stress, can't agree with that because I haven't seen the studies. And just to throw it out there, men are far more likely to commit suicide.
That's definitely true.
Than women. And the reason why is because, this is not me again, this is just what I've read. I'm no psychiatrist here, I'm not trying to psychoanalyze anyone, I'm not trying to diagnose anyone. But it's all due to what they have available to them as resources and how they handle whatever problems or, stress is in their life.
Because women are protected by society, which is right. We are there to protect them.
No, but it's also a part of identifying what is wrong, asking for help, and trying to heal. I just said it. If a man is stressed right now...
Who should they talk to? Most men, when they're going through trauma...
First and foremost,
they have no one to talk to. No.
But you just said that. But then, how is it that they're more likely to go into a relationship healed if they're not going to seek out help? You get what I'm saying there? What we have
the problem
learned,
that a man has, most of the time, their partner cannot fix that problem.
But that's what I'm trying to say to you. Your partner isn't your psychiatrist, isn't your counselor, isn't your social worker, or whatever it is, your therapist. That's not what your partner is supposed to do.
Right, there's a support
because
system.
Your partner is a support system. Now, sometimes they might not be well prepared to support you, and that is okay. It is identifying what flaws we have, where we fall short, and then we find the additional help we need. But if you don't say you need help, how are you gonna get the help? Because you haven't even identified that I am hurt, I need time to heal, I am super stressed, I am depressed, how do I move forward?
You recommend that someone going through struggles, a man, they should tell their partner all of that? Or they should just...
I think it's a relationship.
They should just rock up, fix it,
Never.
And let's move on.
No, I don't believe in that. And I can personally tell you this. I'm from the concept that if something bothers you, bottle it up and throw away the key. Don't address it, don't look at it. That is madness. And what happens...
That's what is taught in the home, though. You know?
I know that's what's taught in the home. And that's what a lot of men do. And then they think they're healed going into another relationship. I'm telling you, that's not how it's done. You haven't worked through the trauma.
Well, if the men are taught that, women are taught the same, that men should bottle their emotion and throw it away.
And I agree that quite a number of women do believe that. And they will say that maybe the man is soft. I agree with that. But I am saying, if you're in a relationship like that, not giving you relationship advice now, but if you're in a relationship like that and your partner cannot identify that you need help, or if you try to speak to them or talk to them and they're going to tell you, boy, you're Safi, I can't manage that. I'm not sure if that person is the best for you.
I agree. Mm-hmm.
Right? Not relationship advice, but that's just me talking out loud and thinking out loud, saying maybe it's something you should consider. Because if you're in a relationship with someone, and I hope you're dating to get married.
That should be the goal of dating?
Well, for me, I'm 30 plus now. I can't be doing that. But
Buy a dog?
I have 3 dogs. But what I'm saying is this, right? You must be in a relationship where you can have a conversation. It must be a case where I'm going through a lot of stress right now at work, and I must be able to talk to you. If it's, it's overwhelming to my partner, then we say, boy, I think maybe we need to go get counseling, we need to go talk to someone. Something needs to be done. It cannot be a
With
case where it's
counseling, though,
dispelled.
who should they seek? The church? Is there
Yeah,
infrastructure out there to
there are
supply counseling
there
for
are
relation?
multiple infrastructures there. I mean, the church is probably the most widely accessible. Almost every pastor, youth leader, or someone of that sort is typically there once you go to the church, and they would be there just to have a listening ear. Sometimes, depending on the type of church, they might have some recommendation, baptize, but not
Yeah,
saying.
nothing is wrong with that. But
Yeah, so I'm just saying there are so many other different parts, the spiritual journey that they might put you on, and I am pro spirituality. Then there are different organizations, there are counselors, there are the health centers, and I know what you're going to say. For Jamaica, it might be a little bit hard to get into the counseling in a health center. So you could always ask them for a private consultation where they could direct you to one of the facilities, right? And I'm sorry I didn't have the information on point, because I did find a few that I've recommended to some of my clients. So there are counselors out there that will help you, and especially the men, your mental health is so important. Stop bottling it up. This is why we're having, persons in such toxic relationships. They don't know how to speak to each other. And I think you're just saying it.
do you
That
think the society is getting more weaker? I mean, the gender role, everything is just flip upside down. Women want to be men, men losing their value. You know,
I don't
I
believe I
think
don't believe in gender
seventy
roles.
percent of Jamaican women secretly hate the men that they're with. It's all over their dream. I mean, just a typical conversation, speaking about someone else, another gender, and they'll show disdain to the men. You understand? And these are persons that are with men. They are married to men. They mother men or sons, but they have a general view of men in a negative way.
I'm not sure if I'm privileged to speak on that part of it, because I haven't had that amount of interaction with that particular type of content. But I think you're saying the gender roles. I think social media has highlighted a lot, and I'm not sure if it's actually a switch, because I personally don't believe that there's truly a gender role. I do believe that we have, in a relationship, different roles each person should play, and it's an agreement that you would have come to,
What's your ideal concept of the gender role in a relationship? I mean, you're dating, right? What do you like? What would you like your man to do in your relationship, or what is he doing to win you? Well, he's a prize. He should be, right?
That's a very interesting question. All right, so
And I say that because a woman like you would not just talk to anybody else. You want someone to compliment you in terms of academic wise, stimulate you in terms of emotional availability and financially. So basically, that man should exercise some level of maturity and competence at a higher level than what you are, so that you can actually learn from him.
interesting. Sounds very. So I'm not sure. This part is a dating episode of the podcast. Or am
Yeah,
I?
yeah, we can chop it up. We can chop it up
We're
and
going to
put
chop
it
it
out
up
there.
here now.
Yeah. You
Don't say
see.
nobody that's a dating. I'm not trying to get any more DMs now, but differently. So, for me, it's mutual respect. It's conversation. It's intellectual is a big part of it. Like being able to have certain discussions, but it's also spirituality. As I said, it's a big thing for me right now, and I think it's something that I'm gonna be holding on to a lot. So if you're not going to be on the spiritual journey, and it's not saying Christianity, spirituality is
Yeah,
different.
but when you say spirituality, just to clarify, does it mean that to have a concept of there's a higher power, or is it actual practice?
Right.
Because I
So
think everything is
right,
diluted now.
right, right. So it's the belief in the higher power. It's the belief in emotional awareness. It's mental clarity. It's how you perceive life. You know, it's your day-to-day practices. There are certain things that I would see and hear from a particular individual. It doesn't matter how much money you make to me, to be honest. I'm not looking for someone for money. That's not my goal. And personally, I believe that I'll be able to manifest any amount of money or experiences that I'd want. It's how you perceive life. It's what your goals
They
are.
still
It's
don't
your
explain the type of
aspirations.
if you should say, like if you have the option to say.
I'm saying that there's no blueprint for who I would say is a perfect person. I'm saying that there's so many different parts to it that it takes time and craftsmanship. So it's not, oh, I want someone to take me on picnic dates and walk under the moonlight
I talk
and
about
drive out.
zodiac sign and
Yeah, and they need to
crystal
be a
ball.
Scorpio and they need to drive a Benz GLE. No, that's not what I'm saying. It's deeper than that for me. So, as I said,
Your DM gonna blow up after this. The boy
okay.
gonna tell us that they are the type, they're Mr. Right and stuff like that. So the reason why I ask you these questions is because in your role, women will come to you for medical advice, but sometimes they'll ask you for relationship advice because you're on the internet, you're on social media, and you're a public figure. Sometimes they will ask for that advice because most of the complaint that women have or the insecurity they have about their body, they might think that their partner have that
Right.
feeling towards that.
Right, and that's why I keep emphasizing that communication is so important. Yes, different types of messages do come in. I don't give relationship advice, guys. I don't. It would always be best to speak to a relationship therapist or something of that sort, or talk to someone at church. They tend to be better able to guide you along that line. With regards to insecurities, it's always best to speak to your partner, the person that you're interacting with the most, because you can't read somebody's mind. If you are insecure about a body part, I mean, there are different ways to ask. The best thing is never assume anything. And I am pro, becoming the best higher version of yourself. So if it is that you believe that I have too much belly fat, I want to lose it, well, let's start changing your nutrition, start exercising a little bit more, stuff like that, so that you feel more confident
Because
in
you
yourself.
have a nutrition program that you
Right, right. So
encourage
this
people to
is
participate in, like a challenge or what's
right. So it's my hormone balancing challenge. We did one early in the year, had around 10,000 participants, and
That's good.
it really went viral. So this year, this part of the year, it's a 10-day challenge, which is geared towards helping mostly women with hormonal imbalance, because this is something that isn't spoken about. I'm pretty sure every time I go on a live stream, I have 9 out of 10 women say, yeah, I was told I have hormonal problem, but they don't know what it really is. And it's geared towards teaching them some of the simple tools that they need to help balance their hormones naturally, start getting back their period, reduce insulin resistance, reducing belly fat, and just start having more energy, feeling better.
This type of program is more for a person with PCOS issue.
Right, so PCOS is one of the hormonal problems that it does help a lot. But there are other different hormonal problems, such as especially insulin resistance, which is a very big factor that we have in Jamaica.
Or you can break it down for.
Right, so insulin resistance is basically talking about how your body responds to insulin, which is a hormone in your body. Most people hear about insulin from diabetes, where your grandmother was given insulin as a medication because she's diabetic. But all of us have insulin that is created in our body from the pancreas to help to control our blood sugar levels. So insulin resistance basically speaks to your body not utilizing insulin well and having high levels of insulin, which makes you more hungry, cravings. You get a lot of belly fat, especially around the mid area.
So you
have
can
problems
have
losing weight.
insulin issue without being diabetic?
Yeah. So insulin resistance tends to be one of the more common. Long-standing and untreated, possibly you can actually become diabetic, because diabetes is also one of the factors that lifestyle modification can help to improve. So there's no pill for insulin resistance. It's nutrition, diet, lifestyle modification, changing the activity levels, those stuff.
And that's what the
biggest
challenge offer.
That's what a challenge offers in a nutshell. And well, the results were actually phenomenal. So for the challenge, I had persons register and they told us what their problems were. And after the 7 days, they told us what some of the results were. And I got
7 days.
That was the first one. The second one just restarted recently, so I haven't gone through the data. As I said, 10,000 something participants, and I had over 2,000 persons respond to the exit form, and it was just crazy, where persons were DMing me, sending me emails, persons with uncontrolled blood sugar levels for how long, realized that they were getting better readings. Persons lost a crazy amount of belly fat. Persons repeated the challenge. One of them that was so impressive, because she had messaged me. She lost around 45 pounds. She had PCOS, and she actually got pregnant also. Persons lost around 5 inches of the belly fat, get back a period, more energy. It's just kind of crazy.
Yeah, it sounds good. With that in mind, there's a market right now where person do augmentation, body augmentation, BBL as you put it. You work out, right? What would you recommend for persons that want to go to that route, thinking it's a faster way to lose belly fat, or to increase certain type of physique on their body? What would you recommend? Especially given that in the news, they would say that there's some risk factors in certain type of procedure that they do.
Right. So personally, if someone wants to improve their body, you want their body, it is your choice. I like when people make informed decisions, but if you're going to get a BBL, I want you to also try and be the healthiest version of yourself. I want you to start making the necessary changes, reduce your cholesterol level, reduce the levels of, insulin, the blood sugar. All of those stuff are very important. And, of course, do like a full screen before you go and get them done. That way we know that you're doing it in the safest way possible. So once they're being safe and they plan to be, active and make the nutritional and lifestyle changes that are needed to maintain what they have done, because they need that,
Oh, you have to maintain it thereafter?
Yeah, because, I've seen quite a number of persons that they went and they did these procedures and they went back to the same old habits, and then they gained back the weight or all the other problems.
Thereafter.
Well,
You kind of look not like you'd expect it for look.
Right, so they don't maintain the shape and the figure that they would have liked. So
hygienic care for women. Do you think men has that challenge too also?
Yes.
Yes. What are some of the things you hear about men not taking care of themselves?
Well,
which aspect of the body also?
Overall, so general hygiene first. One of the things is, I'm not saying that you need to shower 3 times a day. However, if you are active, you are sweating, you
This is
should
for
take a
both
shower.
gender. Should you
Yeah, you
recommend
need
they
to
should
be.
shower 3 times?
No, I'm not saying that. Because there are some persons that if maybe they're in their house the whole day, maybe they don't need to shower that day, right? It's based on your activity level. But, I see where men are repeating their underwear. No, just wear a new clean underwear. Wash your underwear. You get
You
what
know,
I
you
say?
have some person that say that they're.
Or they flip it. I heard that.
I don't know.
Why?
I don't know.
Why would you flip the underwear? Yeah, I've seen it.
You have seen it.
Yeah, it's on TikTok and stuff
Oh,
like that.
okay. No.
TikTok has highlighted a lot for me. Yes. And then overall hygiene care for men. Pull back the foreskin of the penis, guys. That white
Especially for Caribbean men because we don't practice in circumcision.
right, right. You gotta pull it back because that cheesy substance there is sperma, and sometimes it can cause one an odor. Two, it can cause you to have like inflammation or an infection to the head of the penis. And if you have unprotected sex with someone, you can throw off her vaginal pH also. So those are some things to take into consideration. Again, overall, just how you shower, how you wipe.
One of the main thing I think also breath. Your
Oh yeah,
breath.
oral hygiene is a big factor. So I like to say brush twice per day, morning and nights at least. If you find that you're not getting that good hygiene, you can get a tongue scraper because sometimes some of us need to do that, and they scrape from the back to the front of the tongue. Also check if you have like tonsillar stones, those with the small pockets at the back of the
They can see
throat.
it, but
Yeah, sometimes you can see them, right? Sometimes those are stuck there, and that's why you might also have bad breath. So that's something to look into, right? I like a
for
little.
a career or professional person, I know of persons that they say they go to the bed late, right? So they'll shower say around 1 o'clock or 12 o'clock, and that justified them waking up in the morning, or it's still the morning, waking up a few hours after, and just put on their clothes and go to work and say I already bathed 1 o'clock, so it's technically it was in the morning and stuff like that. People have some weird thing about them.
Well, I guess that is dependent on your comfort level. I think it's also them saying that they did nothing in the night but sleep.
Yeah, you hear that one, right?
Yeah, I've heard that. But mostly for persons who are in the colder climates, so like when it's close to winter, I know that I've heard persons saying that because they're saying that they're not sweating and so forth. But again, it's dependent on your activity level, your personal body odor. If you find that you have, a higher body odor, then I'd advise you to just do that extra.
Should women have more than one bath rag, for the private area and the body?
So you don't even need a rag to wash your private area, to be completely honest. And just as we're talking about that, you don't need soap on your vulva. That's the outside part. If you're gonna use soap, something mild, unscented. So I know we have this concept of body wash and all of these scented soaps to smell like rainbows and cotton candy afterwards. But the problem is the scented products tend to have a lot more chemicals, which can throw off your vaginal pH, can cause irritation, it can cause drying of the skin, and especially down in the vulva that is so sensitive. So something mild, unscented. Personally, I like Cetaphil and Dove for those two.
Okay. All right. For the message that you're putting out on your platform, have any corporate company reach out to you to partner with you to spread their awareness and stuff like that?
In Jamaica, ironically, no. I've had a few international persons reach out to me, though.
Yeah.
Yeah.
You think more can be done to spread the awareness in school?
A lot can be done to spread the awareness in school.
Because I think most girl growing up, or no women, the first time they encounter about period or menstrual cycle is um, in school at the primary level.
Yeah.
As I said, those things are not taught about.
Right. So they do have, some schools have a little about period health and sexual and reproductive health. But I don't think it's enough, because that's only if you went to like, what is it? In the States, it's sex ed. What's the name of? We have something like that in Jamaica. Like a few other schools. I think I had one class in high school, if I'm not mistaken. And it's not something that they really talk about much. Just if you have sex, you'll get pregnant. Don't have sex, right? That is not enough. I know a lot of the parents are probably saying, but I don't want them teaching my children about sex. Well, guess what? Pornhub is going to teach them about sex then. And it's not going to be the safest sex that they're going to do. And if somebody comes to them and tells them about having some type of sexual relation, they're more than likely going to be oblivious. And, you know, I think they're at more of a disadvantage in that sense.
So how should a parent, or do you encourage both parents should how to sit with the child and have that conversation?
Yeah, I think
More than likely, a mother would be more comfortable. I know I'm father to the son, a mother to the
no, I
daughter.
think both parents should be involved in their child's life.
At what age do you think that conversation should come? I
It
mean,
depends.
safety.
It depends on the parents. It depends on the children. You know, I've heard different persons in different places of the world that start talking to their kids about sex. 8, 9, 10, 11, 12.
Because, Doc, I think what the fear with parents is that when you're telling them about it, you're
encouraging them
yeah,
to.
you open their mind to be curious about it, and they just don't want to have a conversation about it until, you know, that situation arises. But you're saying that they should actually...
But the problem is you won't know when the situation arises, because your child more than likely doesn't feel safe to come and speak to you about it. And when the situation arises, like, how many persons have you heard went to their parents to tell them that, oh, I want to have sex now? In Jamaica, you can't do that, right? Right? I've had teenagers DM me. I have a boyfriend. I think I might want to have sex. What should I do? I can't tell my mom. I can't give them any advice. I can't.
But you think they should have that conversation with
They should have the conversation with their parents. They should be able to speak to their parents about it, you know.
You think parents are not mature enough, or I just want to face reality? Because I think most parents, they are doing the same thing that their parents did,
right?
You know, especially our generation. I mean, we know the real world or what society is, but we'll still shun or kind of protect our children growing up and not tell them until they have to experience it themselves, which is not the best method. But some person just don't want to open that box.
Yeah, I think that's part of it, and I think maybe they don't feel as if they're equipped with the knowledge and the skills to do so. And as you rightly said, a lot of them, they didn't get that exposure. Most of them probably only had any knowledge or interaction about sex in that one class in high school, and then the second time when they actually went and had sex. So maybe that's part of it. But I think there should be more of a movement to get parents more educated and comfortable.
You think education, sex ed education, should be more of a policy than, because they have this thing in Parliament that they're saying that it should increase the age of sexual consent to 18. And that, again, is tried to be a deterrent to prevent early exposure to sexual activity and early pregnancy and stuff like that.
But I think education is one of the biggest factors in it. If they don't know, they're not aware of what's happening, then, you know, I've had kids say, like, so if this and this happens, is that sex, or kissing is sex? Can I get pregnant from getting kissed? You know, these things, it sounds naive, but it's it really does say that they're not aware of what is actually happening. And I'm not saying they get into gruesome details. It's more of being comfortable that, Mommy, Daddy, I have a boyfriend. I want you to meet him. Do you think he's a nice person? Do you think a conversation where they can feel more comfortable. So if somebody says something inappropriate to them or touches them inappropriately, you're the first one to hear. Kids are afraid to tell their parents if something is wrong. That's why
So that could fix a lot of things,
I
even
think that
sexual
might.
abuse,
I think that
abuse
might.
overall.
I think that might also help, because we've also given these organs some strange names.
In terms of?
You know, um, well, everybody know what coochie means now, but I can't remember the name. I heard this weird name that they had for the vagina, and the whole time is like the little girl saying, "Oh, him touch my pencil," like say something like that. And nobody don't know what the baby talking about. The baby trying to say that until someone say, "Oh, show me where," and show. You get what I'm saying? Like, these type of things, they should be aware of what the actual terminologies for the different body parts are also.
I remember back in high school, it was around 10th grade. It was around in 10th grade, I brought a sex ed science book about sexual education and stuff like that. And this, I was sitting with a friend and we were opening the book because I major in science and other stuff. And one student reported to the teacher said that I have a sex ed book, and the teacher lost her mind. I mean, she concealed the book for like 12, literally about 12 days. I had to go to the science teacher and to say to her that trying to make her come on my side and say, isn't this a sexual education book? Isn't this not pornography? It's literally telling about sex and reproductive organ and, UDI and stuff like that. But you're right, adults are not open to have that discussion, to their child, and I think that's them from a lot of problems. So when they watch social media, the YouTube, the Pornhub, and they get curious, they keep it to themselves, them talk to them other peers, and then they act it out eventually, and then they spiral into this one big, toxic environment, basically.
Yeah.
So your platform is definitely needed, necessary, and we're encouraging it to keep on pushing the message. And for the corporate company that haven't reached out to Dr. Brown, you're missing a big opportunity, to represent, to have an ambassador that can really push a product and to really show that you're contributing to the welfare of women in Jamaica. You understand? So they should reach out to you definitely. And think you're doing a fantastic job.
Thank you so much. And, I just want to big up your platform also. Spreading awareness is a big thing for me. So, coming and just having me on the platform and giving them a taste of what we have to offer and a lot of the information and knowledge that we're sharing on a day-to-day basis. I appreciate you for that.
Yeah, that's good. Someone asked me, you always drink a lot of water. Is that personal health or?
Yes. Yeah. So, water is just one of God's greatest gifts, and I think we should really utilize it a lot more. A lot of the times I think we're hungry, we're dehydrated, we're having a migraine, maybe a little water would have helped. Not saying that you can't overconsume water, but it does help for digestive purposes, clears the skin, helps with overall your kidney function, and it's just a better option.
You think women
should drink more water?
Yeah.
Hold it more water. Consume more water. We do put a lot of processed foods and products in our body a lot. So giving yourself a break and giving a shot of your stomach and your liver a shot of water from time to time is a better option. Yeah.
Sure.
Mm-hmm. Yeah. Plus, it legit has no calories whatsoever.
Yeah.
So you can't go wrong with it, right?
All right, no problem. All right, guys. So that was an interesting talk with Dr. Monique Brown, beautiful Dr. Monique Brown. And she's also encouraging you to check out our platform. Check out the challenge if you haven't signed up. Check out our platform on fituniversity.org. You can sign up for that also. We have some fitness workout tip for you as well. Any last word where they can find you, what they should look out for 2023?
All right. So for 2023, we're gonna come new and improved. My YouTube channel is also gonna be launched and revamped. We're gonna have quite a number of interviews also, and we're gonna have more challenges, more educational type information, fun. It's gonna help you to become the best version of yourself, to improve your health, your wellness, and start feeling better. If you need to reach out to me, you can contact me on Instagram. So it's Dr.Nique, so DOCTORNIQUE on Instagram, TikTok, Dr.Nique. And YouTube is the same thing, right? And I appreciate you for having me here. And I'm looking forward to more interviews and, a lot more educational content from you also.
Yeah, definitely. All right, guys. Rebirth podcast. We're out.
Palpatine protection.